First things first, I want to point out an issue that only a few people talk about, and that's only the people that are affected by this problem. Racial disparities still exist here in America, but especially in the hospital setting. Our African American patients expect to be treated with the utmost respect and kindness. However, that hasn't always been the case. I want all healthcare personnel to understand what minorities go through when being treated here at our facility and facilities across the nation. But I also want us to come together in unity to implement better policies, enforce equality, and employ ethical behavior so that our patients across the board can have a better experience in the hospital setting. From the minute that people who look like me walk through the doors and seeking of help and aid, they are automatically stereotyped. Healthcare workers assume that these patients don't have insurance. And you know as well as I know that in a capitalist society, without the ability to pay for something means you won't get treated the same as everyone else who can. Regardless if you have insurance or not, African Americans should receive the utmost aid in emergencies as well as non life threatening instances. Instead of assuming that people of color don't have insurance, let's assume that everyone deserves the right to be treated equally and fairly. Let's not forget the astonishing rate that Black women die from childbirth than white women. 3 times more likely that a Black woman can die from childbirth. 3 times. Why, you may ask? Because Black women are not getting the proper child care before, during, and even after childbirth. Imagine if that was your aunt, your sister, your cousin, dying from giving life because the healthcare workers didn't care for them how they were supposed to be cared for. Taking a look at a broader perspective, African Americans have less access to healthcare overall. And this doesn't come without its consequences from both parties. It's like a domino effect. African Americans will be in poorer health when they don't have access to healthcare, which means when they do seek help and are treated unfairly, they won't be as respectful to healthcare workers because they aren't getting that same respect. They then won't be able to trust us healthcare workers and may not even seek help as soon as they need it. I don't know about you, but I personally wouldn't want anyone to not access healthcare because they aren't getting the quality care in a hospital setting. Some claim that this phenomenon of racial inequality doesn't exist in healthcare due to the oaths that doctors and nurses take when first becoming healthcare personnel. They vow to treat everyone as equal and care for them to the best of their ability. If that was so, why are nurses still reporting racial disparities in the hospital? There is still data of racial disparities in hospitals amongst doctors, nurses, and patients when that number of those reports should be 0 to none. Others claim that racial disparities don't exist because racism itself has been eliminated from our society. Let's make it clear that 2020 has shown some people's true colors, and those colors tend to shine in a rainbow at their place of work. What I'm saying is that people's attitudes follow them from home to work, including healthcare providers. How they really feel about you will show in the kind of care that they give, and it's undoubtedly unfair. African Americans shouldn't sue, complain, or even die for us to change the way we treat one another in the hospital. So let's work. Let us healthcare workers come together for a solution to this major problem affecting our dear patients. Studies show that more diversity training that we receive, the more we understand one another and treat each other as equal. Let's approach our patients in a kind and soothing manner. Let's be less condescending when we speak to our patient so that we can understand what they are going through. So let's gain their trust back. Implementing these policies amongst everyone can result in less racial disparities. Last but not least, let's get out of our mind these crazy stereotypes we have about minorities. When we come together and recognize disparities in the hospital and actually do something about it, we can look forward to more respectful and ethical environments where everyone is treated fairly.